Hello everyone. Welcome back to our channel. Today, we are diving deep into a topic that affects millions worldwide, acne vulgaris. Whether you're a teenager or an adult, acne can be a challenging condition to manage. Let's explore what it is, its causes, and how we can treat it effectively. Acne vulgaris is a chronic inflammatory skin condition characterized by the presence of blackheads, whiteheads, and inflammatory lesions like papules, pustules, or nodules. It's most common in adolescents and young adults, but can affect people of all ages. So, what causes acne? The primary factors include hormonal changes, certain medications like corticosteroids and oral contraceptives, and mechanical factors such as wearing hats or headbands. Androgen excess, which can be due to conditions like polycystic ovary syndrome, also plays a significant role. Additionally, lifestyle factors like diet, stress, and smoking can exacerbate acne. Acne occurs when hair follicles become clogged with oil and dead skin cells. This environment allows the bacteria Cutibacterium acnes to thrive, leading to inflammation and the formation of acne lesions. Acne can manifest in various forms. Comedonal acne includes blackheads and whiteheads. Inflammatory acne involves papules, which are small, red bumps, and pustules, which are similar but contain pus. Severe acne can present as nodules, which are large, painful lumps beneath the skin. The treatment of acne depends on its severity. Mild acne is often treated with topical therapies, while moderate to severe acne may require a combination of topical and systemic treatments. The goal is to reduce the lesions, prevent scarring, and maintain clear skin. Topical treatments are the first line of defense. Retinoids like adapalene and tretinoin help unclog pores and reduce inflammation. Benzoyl peroxide is another common treatment that kills acne-causing bacteria and helps to clear existing acne. For more severe cases, oral medications may be necessary. Antibiotics such as doxycycline and minocycline can help reduce bacteria and inflammation. Isotretinoin is a powerful drug often reserved for the most severe forms of acne due to its potential side effects. In addition to these treatments, adjunctive therapies like chemical peels and hormonal treatments can also be effective. For women, oral contraceptives can help regulate hormones that trigger acne. Education is crucial. Patients need to understand that treatment can take time, often up to 12 weeks to see significant improvement. It's also important to avoid quick fixes and follow the prescribed treatment regimen consistently. Lastly, maintaining a healthy lifestyle can support acne treatment. A balanced diet, good skincare routine, and managing stress can all contribute to clearer skin. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with anyone who might benefit. Remember, while acne can be persistent, with the right approach, you can achieve clear skin. See you in the next video.